issues going on. If we restore circulation and get to the root of his erectile dysfunction, that's usually a little blue pill can definitely remedy that. But are we getting to the root? Are we really looking at this man as a whole? Are we really getting what was going on with him to begin with that caused this? Because this just didn't come out of thin air. He wasn't born with this. He didn't always have this. So,
right.
So most of these things, prostate as well. I don't see as much prostate cancer as just prostate dysfunction. Urinary disruption is one of the main ones I see. Some of my older males. And definitely there's a lot of circulation issue there. Overall circulation. And what I love about Chinese medicine too is that we look at the root. If we have something going on, let's speak about low testosterone. If we have low testosterone, we have an adrenal issue as well. There's something going on endocrinology wise that this man is not producing enough testosterone. So I do acupuncture that signals the hypothalamus to release testosterone, but at the same time, I'm very interested in what is this man eating? How is he sleeping? What is his cortisol? What is his adrenal function? And then my favorite thing for low testosterone, I'd like to put a sign up at all of those clinics that give men shots for low T, is exercise. Because we actually men release a ton of testosterone. Women do too, but men release a lot more with exercise, with body weight exercise, and with, or lifting weights. So some kind of weight-bearing exercise literally releases the testosterone that they need. But we can inject them with testosterone, or we can do this. So I use the acupuncture to raise a man's testosterone by inciting his hypothalamus to do so, but teaching him to respect his cortisol by sleeping well and getting off of devices 90 minutes before bed with a blue light coming from them that disrupts cortisol, and really a comprehensive look, because there's never just low T, there's never just erectile dysfunction, there's never just prostate dysfunction in isolation. Absolutely. And I think we've been taught, we went to the pediatrician when we were little, and we got a little medicine for what was going on. And we still have this disease, here's a little pill, here's a disease, here's a little pill. So we've gotten complacent as patients. I encourage my patients, I love when my patients will get involved and really become part of their healing. And this care that's involved with most of my patients is cooking and or if they don't like to cook, getting the right nutrition, somehow getting the exercise. We pay attention to their social interactions, their time spent outdoors, their time spent meditating, or whatever is meditation for them. Some people, meditation is sitting in the lotus position and with an om, and some people walk or a shower, or something that relaxes them. So we look really globally at patients and find out where we can get them take an active part in their healing. In practice, it couldn't be more clear. The emotion of what's going on with the patient has to do with what's going on. And there's a chicken or egg thing there. Did the disease start and then the emotion start, or did the emotion cause the disease? But that's really the difference between, I think, traditional TCM practitioners like myself focus more on the organ system itself, more on labs and really circulating to that particular organ system. But the 5 elements deal more with the emotions. I think we both do some of each, but their focus is more on the psychological aspect of everything, and ours is more on the physical.
Awesome.